Hi, this is Aishna Shrigyan and welcome back to my channel. So in today's video, we'll be discussing about the incident reporting. So let's first begin with some examples. Our patient was supposed to get his right knee operation done, but instead his left knee was operated. Now, what is this? This is definitely an incident. I'll give you another example. A patient who was admitted was sleeping on his patient bed, but the patient bed does not have the bed railing, and when he was turning to his right, he just fell off on the ground and got some minor injuries. This is again a classic example of incidents, right? So it has been observed that there are a lot of incidents that happen in hospitals, but oftenly most of the hospitals have the incidents which happen goes under reporting, mainly because of the fear of punishment. So it is very important to understand the significance of the incidents reporting and how can we do the reporting of the incidents. Well, first understand, as I told you in the example, all the incidents as I've explained it to you, you all can now have an idea that incident is actually something unpleasant happening or event that happens in the hospital. Well, there are different types of incidents. Incident might be near miss, incident might be no harm, incident might be adverse event, or incident might be sentinel event. Well, then what is near miss? Near miss is a type of incident that was recognized prior to its happening. That means it was recognized just at the last moment, just before it was about to happen. For an example, the nurse was administering the wrong medicine to the patient, and the moment she was about to administer, she recognized that the medicine was wrong and she stopped it right away. This is a classic example of near miss. Now, what is no harm? No harm is something in which the event has taken place, the incident was not recognized prior, but fortunately no harm was done to the patient. Again, taking the example of medication administration error, the nurse has administered the wrong medicine to the patient, but fortunately no side effect or no complication has happened to the patient. Oftenly in most of the hospitals, near miss and no harm are used interchangeably. In both of these incidences, either the incident actually has not come to the patient, or even if it has come to the patient, no harm has been done to the patient. Now comes our third type of incident, that is the adverse event. Now what is adverse event? Adverse event is a type of event or an injury which requires the medication management or medicine management. Now here medical management basically means which includes the diagnosis and the treatment. Give an example of the adverse event. A patient was walking and immediately fall off the ground and he got some minor laceration on the knee. The first aid was provided to the patient, some painkillers were given, and the patient was fit to go, right? So these type of incidents come under the adverse event. Now comes the most severe type of incident, that is a sentinel event. Sentinel event is a kind of event which results in the death or loss of function which lasts for minimum 15 days. Now the impairment, the loss of function might be physiological or might be psychological, right? Again, the medication administration error, if the wrong medicine administered to the patient and patient dies because of the complication, this is again a classic example of sentinel event, right? Now, how the incident reporting happens in the hospital? Well, incident reporting is actually mostly done by the person who witnesses the incident happening. He or she is supposed to fill the incident reporting form, describe the event that happens and submit it to the quality department. Now the incident which comes under the near miss or no harm might be reported within 24 hours. The adverse event should be reported within 6 to 8 hours, and the sentinel event should be reported immediately to the quality department. Once it is being reported, the quality department, with the help of the departmental head, the concerned departmental head where the incident has taken place, need to find out the root cause analysis. Then once the root cause analysis was find out, then we have to see what all immediate action, the corrective action is taking place, and what all preventive measures we need to take place so that the same incident does not get repeated in the near future. Here I talked about the root cause analysis. The root cause analysis detailed discussion will be having in my coming video, right? So once the preventive measure has taken place, we again have to monitor that whatever training we have provided to the staff or whatever changes we have made into the process or procedures is actually being compliant as per the modified or new policies, right? So this is actually all about the incident reporting. Now most of the common incidents that happens in the hospital are patient identification error, where two patients are having the same name and the healthcare professional, before verifying the patient with the his or her full name and the unique identification number, has done any, has either administered the medicine or has taken the patient for the diagnosis, right? So before doing any activity to the patient, we need to verify whether we are actually having the right patient or not. So the right patient identification is supposed to be done through the patient full name and the unique identification number. That is, we need to have the two identifiers for the correct patient identification, right? So apart from the patient identification error, we also have the valence, we have the incidents of fall, we might have like any other clinical incidences that are most common in the hospital. So that's all for today's video. In my next video, we'll be discussing about the quality tools which are used in the quality assessment and quality improvement processes, which we oftenly use actually in the hospitals. Till then, thank you so much. This is Seshan Srigan signing off. Thank you.